raised to take for granted, the right to life, protection from climate change, and our role in society were profoundly denied based on age and rooted in ageism. In other words, how on earth could the following have happened in Canada? We saw the right to life and the right to health of older people completely abandoned. This is exemplified by those living in long-term care homes, where 80% of the deaths occurring in the first 2 waves of the pandemic were older people. We all know what happened. A situation so bad that the Canadian Army had to go in to long-term care homes, and the resulting report was so horrific, it was hard to read, much less fathom. We saw older people denied the right to health, as those living in long-term care homes were barred from hospitals and left to die unaided by COVID-19. Moreover, governments instituted ageist triage protocols, like the one we're going to discuss that happened in the province of Alberta. And if that wasn't enough, in the midst of the pandemic, the province of BC was devastated by a heat wave. Between June 25th and July 1st of last year, the temperature reached an unbelievable 49.6 degrees Celsius. Now, we all know British Columbia normally has a temperate climate without extremes, and they did not have a heat action plan. And as a result, there was a lack of access to cooling stations, a lack of targeted supports for at-risk populations, including older people. So of course, this climate disaster disproportionately killed older people. It was estimated that there were 569 heat-related deaths that week, approximately 79% of which were people over the age of 65. Human Rights Watch actually called out the government of BC for its failure to protect older persons, resulting in unnecessary suffering and deaths, clear human rights violations. Finally, as we have social upheaval and the rise of populism, and I want to talk about what happened in the city of Ottawa, my city, when the so-called Freedom Convoy of truckers took over the city for 21 days. Older people and persons with disability were heavily impacted if they lived in the downtown core. Imagine for a moment having dementia or caring for someone with health issues and listening to 21 days of nonstop honking. Care workers and healthcare workers were unable to get to their jobs because of menacing behavior or the inability to get food because of the blockade in downtown streets. So a year when older persons were devastated by the pandemic, climate change, and social disorder, we would have expected a more robust response from governments, not only in Canada, but around the world. Indeed, civil society witnessed stunning indifference to the human rights of older persons, an indifference that allowed us to ignore the anguish experienced by older persons, rendering the lives of those suffering as meaningless. Now, this is ageism in its purest sense: immoral, reprehensible, harmful, and deadly to the life and security of the old. We as civil society and as human beings need to expose this ageist indifference that led to these events and demand that they not happen again. Now let's talk about the issue that led us to this place. And then I want to look at one tool to respond. My organization, the International Longevity Centre Canada, is a human rights-based organization, as was mentioned, and we're part of the Global Alliance of 16 countries. We're committed to battling ageism as in all its forms, and indeed our founder, Dr. Robert Butler, coined the term ageism back in 1969. Now, as I mentioned, the last 2 years have been a magnifying glass on ageism, and I agree with Ashton when she said it's always been there, we're just seeing it more. But like no other time in history, the last 2 years has illustrated the need for a human rights-based approach to ensure older people are treated equally. And don't kid yourself, what we witnessed in the last year was the wholesale attack on the human rights of older people. Now, I'm going to advocate that we have a great opportunity here to respond to rampant ageism in a most compassionate way, a way that upholds the human rights of older people. Let us support a United Nations Convention on the Rights of Older Persons. Now, a United Nations Convention is a legally binding document signed by member states of the United Nations, which sets out in detail the rights each country must bestow on its citizens. Think of it as a separate set of laws that protect older persons' rights internationally. We know a number of other groups have the protection of the United Nations Convention, such as women, children, and most recently, persons with disabilities. Yet we don't have a convention on the rights of older persons like there are for women, children, and persons with disabilities. And I think the pandemic in the last 2 years has shown us that we need one, and we need it now. Now, I'm going to give you a quick moment to tell you how a convention would support the rights of older persons. In general, a convention is a method to achieve positive change by combating ageism, guiding policy making, and improving accountability of governments at all levels, which we certainly need. A convention would also educate and empower and would see older persons as right holders with binding protection under international law. And let's take a closer look at what it would have done for older Canadians in these last 2 years by examining some examples of how older persons' rights have been violated and how a convention could help. Now, in Canada, the Charter of Rights and Freedoms, Section 7, notes that everyone has the right to life, liberty, and security of persons, and the right not to be deprived thereof. Yet older Canadians' right to security was denied during the pandemic. As we know, older persons were left to die unaided in care homes. Despite years of warnings, with report after report stating that long-term care system was inadequate, nothing was done. And let's not forget, prior to the pandemic, the press was full of stories of elder abuse and institutional care, and nothing was done. So when the pandemic hit, it was a perfect storm for the large-scale death of frail older persons, evidenced by Canada, disgracefully, having the worst death rate in long-term care of all OECD countries. So what could a convention have done? Well, it would see older persons as right holders, equally valued, whatever their age, and it would lead to a situation where adequate policies and supports for older persons requiring care would be realized. This means measures will be put in place to make long-term care safe and healthy for older persons. We also know older persons were denied access to hospital and then left to die of COVID unaided. As COVID cases and anti-vax sentiments rose, in Alberta, for instance, the healthcare system was on the verge of collapsing. So what did the Alberta government do? It released a triage protocol that stated that people over 60 with a poor chance of survival would be denied access to intensive care units. So older people pay with their lives for the poor choices of government and ill-informed citizens. These ageist health triage protocols put older persons at risk, diminishing their right to life by naming them as a group who would be denied care. Imagine if we did that to any other race, religion, color, or creed. So what would have a convention done for older persons in these situations? Well, it would guarantee the right to access to Canada's universal health coverage. In other words, in future pandemics, older persons would not be denied access to health care or any form of care based on their age. We also have an enormous amount of information on the impact of heat waves and other natural disasters on older persons, and we know that special provisions are needed for older persons. Back in 2007, 2008, I worked in the Canadian government who had provided funding to set into place policies for older persons in disasters, including tabling a paper at the United Nations Commission for Social Development on how to build a global framework to address the needs of older people in emergencies. We brought experts on aging and emergency preparedness from around the world to look at how to better support people in disasters. The government of BC was there and in fact provided a lot of important information. Yet the horrific deaths this summer and last summer in BC show that no level of government has a clue to how to deal with climate-related issues for older people. We know that, for instance, one older man died waiting 90 minutes for an ambulance when he lived 10 minutes from the hospital. Sadly, statistics from disasters around the world show BC is not alone in its inability to respond to the needs of older persons and climate change. We know that 75% of those who died in Hurricane Katrina were over the age of 60. Back in 2013, about 40% of those who died in the typhoons in Philippines were over 60, and 70% of those who died from floods in Argentina were older persons. And folks, this isn't rocket science. Protocols on protection of older people exist and should be in place. We also know that older people, particularly older women, play important roles during emergencies. So we need older persons as resources, and they should be considered in all the work we do to respond to disasters. So how would a convention help? A convention would recognize that specific protocols are needed for older persons, and governments would implement policies and legislation to protect them when disasters occur. Member states of the United Nations would be obliged to submit regular reports on how rights are implemented, and blaring abuses like the ones we just witnessed would be addressed and concerns raised in reports for activists to follow up on. I also want to just take a moment to talk briefly about the war in Ukraine. We know that older people are disproportionately affected in emergencies, and war is the ultimate emergency. We have already seen horrific war crimes like the shelling of the care home that killed 56 residents about a week ago. We know that older persons who have health issues cannot line up for food, stand outside overnight to get trains to other countries, much less run from bombs. And we need plans in place and real rights-based frameworks like a convention to have them included in all planning. So where are we now in terms of convention? In May 2020, the Secretary General of the UN wrote a really important policy brief on the impact of COVID-19 on older persons at the United Nations. I'm really proud to say that Canada was instrumental in getting 147 countries to sign on to that document, which buried deep inside had a reference to the need for a convention. On the other hand, Canada and other developed countries are still not supporting the convention, despite clear evidence of the need. Back in 2018, ILC Canada and a number of our partners put a petition before the UN at the Open-Ended Working Group on Aging, asking Canada to support, and the Canadian delegate mentioned that the door was open for Canada to support the convention. But since then, they haven't done anything to move forward on it. We need to start working together harder on that, and a lot of us are starting to take those steps. And we definitely need to grow and learn about from the treatment of older persons in this last 2 years in Canada and around the world. So we must demand that member states of the United Nations continue the history of empathy and support for human rights, as they have for so many other groups who have faced prejudice and neglect, and that those same protections need to be provided to the old. So how can we as civil society start to make this happen? Well, first of all, we should be furious about the rights violations we've seen. We need to talk about rights for older persons, talk about the right to life, the right to health, the right for protections in disasters. We need to explain that to our governments that a human rights-based approach is needed through the support of a convention. As a member organization of the Global Alliance on the Rights of Older Persons, ILC Canada is proud to support the Age with Rights campaign, raising awareness and mobilizing grassroots support for UN Convention in countries around the world. And I want to ask you to join us by considering becoming a member of GARAP. I also would ask you to join us at the United Nations Open-Ended Working Group on Aging. The ILC Canada has a side event, they're called side events, to talk to member states about the work. And I want to invite you to that event. It's called Older Women Rock the World, the right to participate and those who make it happen. We have a terrific lineup of speakers, including former Governor General Adrienne Clarkson. We have Ambassador Bob Ray and a number of others joining us. So here's the piece. So thank you for putting that up. You can see all the speakers there. And I also hope that you will join us in demanding a convention. I want you to take a moment and think about the older people and the impact the last 2 years has had on them. And I really think that each one of them had the right to health and the right to life and the right to protection from disasters, and I'm sure you all do too. One thing the last 2 years has taught us is that we need societal change that depends on all of us, government, civil society, and citizens. We need to come together and celebrate and respect the gift of longevity. Thank you very much.
Thank you so much, Margaret. Very well said. It is my pleasure right now to introduce Dr. Kieran Rabharu. I will just read your bio very quickly. Dr. Kieran Rabharu is a professor of psychiatry at the University of Ottawa and geriatric psychiatrist at the Ottawa Hospital. He obtained his MD from the University of Western Ontario and practiced in rural as well as urban settings as a family physician. He is a fellow at the College of Family Physicians of Canada. He also went on to specialize in geriatric psychology in Canada and the United States, and is honored to be a founding member of the subspecialty of geriatric psychology, psychiatry in Canada. He also co-leads the Canadian Coalition of Seniors Mental Health and chairs the board of International Longevity Centre of Canada. Welcome to today's session. We are so pleased to have you here with us.
Thank you. Thank you, Laura. Thank you for inviting me to be part of this wonderful discussion. I've really enjoyed every speaker this morning. Ashton did an amazing job, as did the other speakers. I was just so happy to be on it.
Thank you. Well, welcome and take it away.
Thank you. I just want to remind you that I'm speaking not just as an advocate today, but as someone who takes care of older people every day of my life in different settings, in their homes, in long-term care, and in the hospital. And what I'm about to tell you is my firsthand experience over 40 years of doing this. Never before in history have older people's human rights been violated as we have recently witnessed all around the world. Older people have been left behind, voiceless, invisible, and expendable. Their basic needs have been ignored, neglected, or dismissed. Now, human rights are foundational entitlements for all human beings. And if we permit and thereby promote violations of human rights of older persons today, it is guaranteed to impact us all tomorrow. Therefore, these precious rights must be valued and protected. Now, the root cause of all of these issues we're talking about boils down to one word, that's ageism. That is the way we think, the way we feel, and the way we behave towards people because of one thing. It's just that number, that age. Ageism is highly prevalent, ubiquitous, and insidious. Ageism prevents older people from taking their rightful place in society. Ageism can be institutional, interpersonal, or self-directed. Institutional ageism refers to the laws, the rules, the social norms, the policies, and practices within institutions that unfairly restrict opportunities and systematically disadvantage older people simply because of their age. Just because of their age. Interpersonal ageism arises in interactions between two or more individuals, and we're all familiar with that. And the last part, the self-directed ageism, is when I look in the mirror and I don't see myself at the same age as I am. When the ageism is internalized and actually turns against ourselves. There is a real and urgent need to combat ageism in the world, including in Canada. Now, one thing is for sure, the world is aging rapidly. The projected number of people over age 65 is going to reach 1.5 billion by the year 2050. But not all older people are the same. We're not a homogeneous group. And most of us are relatively healthy, secure, and engaged in society, and we're not a burden. And we don't want to be a burden, but that is where things change. So how does ageism impact our world? Well, we know from the WHO report that 1 in 2 people globally are ageist. As Ashton said earlier, this is not new. This has been going on for decades, but ageism has continued to silently harm our global health and the global economy. It continues to violate human rights, create inequity and injustice, and loss of dignity for older people, and intergenerational conflict. Ageism forms a barrier to policies that promote healthy aging. It intersects with ableism, mentalism, sexism, and racism, and many other isms. It causes poor quality of life and premature death in people. It compounds the disadvantages over the entire life course of people. Sadly, in Canada, ageism is very pervasive across many institutions, and I see it every day of my working life. Health and social care, where age-based rationing is widespread. No one gets up in the morning to say, I'm going to go and kill 20 older people today, but that's exactly what happens in our day-to-day work. In the workplace, older people are frequently disadvantaged. Social and popular media blatantly or unwittingly portrays ageist views against older people. Egregiously, older people are excluded by the policies and laws of our great nation. Special populations of Canadians, for example, the Indigenous older people, are highly vulnerable to human rights violations in Canada. Older people are systematically excluded from life-saving and quality of life enhancing research, gathering of vital statistics, and other relevant data collection. This biased data contributes to ageism because it is relied upon by governments, by institutions, corporations, and others to create this unfair, inequitable, and unjust current ageist policies and the laws of our country that drives disproportionate allocation of, quote, scarce, unquote, resources away from older Canadians. We can talk more about that in the Q&A if you wish. Now, we talked a little bit when Ashton was talking and Margaret about the COVID-19 pandemic. This has been a true wake-up call for all of us. It has exposed and laid bare the impact of decades of ageism and catalyzed unprecedented catastrophes for older people. They have experienced accelerated and precipitous declines in both physical and mental health, cognition and function, which have resulted in frailty, insurmountable fear, anxiety, even depression and suicidal thoughts, loss of dignity, and requests on a regular basis for medical assistance in dying. Gut-wrenching, inhumane stories about older people and their families are shamefully abundant to the extent of being normalized in the media and in our society. What do you expect? You're 85 years old is common. The rapidly aging population that forms the fabric of our society is being left behind, made invisible and marginalized. The human rights are neither being protected nor respected in every sense of the word. Thankfully, the WHO has just published last year the first evidence-based report on ageism. It has illuminated the fact that meaningful and sufficient data on older people may not even be collected and or disaggregated by age to inform our policy, which has led to ageist and ineffective policy, which leaves older people behind. This must change now because ageism hurts us all. The most comprehensive global review of the health consequences of ageism is a meta-analysis with 7 million participants, which demonstrated poor health outcomes in 95% of studies. And there was a very strong association between ageism and mental health conditions. There's a staggering economic impact of ageism. The annual healthcare costs just in the United States alone is estimated to be $63 billion due to ageism. There is cause for cautious optimism that if action is taken, then significant health benefits and cost savings can be achieved if ageism is reduced. Yet to date, ageism has not been seriously addressed by any nation, not even Canada. Ageism is a major barrier to the enjoyment of human rights by older people. It must be reduced by changing our societal, legislative, and policy processes and structures. And other people have alluded to this. This is at the heart of the UN's 2030 Sustainable Development Agenda, which is the agreed upon blueprint for building a future of peace and prosperity and a healthy planet. Canadian society across all sectors and disciplines face an urgent ethical, moral, and legal imperative to establish ways to combat ageism. Now, Margaret talked about this. The United Nations member states, including Canada, have, through this resolution on the UN Decade of Healthy Aging, called for a national action to fight ageism. More inclusive policies and laws, structures, and services to enable older people to live securely and enjoy good health. Madame Michelle Bachelet, the UN High Commissioner for Human Rights, stated, and I quote, "In 2022, we plan to work with partners to combat ageism and age discrimination under the UN Decade of Healthy Aging and support the open-ended working group on aging to develop a dedicated international instrument on the human rights of older people." I would like to see that happen. What can Canada do? Well, Canada, working with ILC Canada and in partnership with the International Federation on Aging, proposes a Canadian solution called Canadians Against Ageism, or CAA in short. CAA is a comprehensive Canada-wide program to combat ageism against older people, while strengthening, protecting, and promoting their human rights and changing the narrative around aging. This project will be conducted in collaboration with key partners and stakeholders using the 3 targeted strategic evidence-based interventions outlined by the WHO report, and namely education across the lifespan, enhancing intergenerational relations, and influencing policy and laws. CAA is aligned with WHO and the UN resolution to combat ageism globally through national efforts. At the heart of our mission is to strengthen human rights and the voices of current and future older Canadians. Now, this is a big, hairy, audacious goal of the CAA, which is to reduce the impact of our common enemy, which is ageism, on all people across Canada. But we need all hands on deck to succeed and help Canadians change the way they think, the way they feel, and the way they behave in a more positive way towards older people. ILC Canada and the IFA will work in partnership with committed Canadians and any organization who are interested in working with us in focusing on older people and changing the way they encounter ageism in life. We welcome your expressions of interest and the desire to be part of our project and to provide support for it in any form you might have at your disposal. For this project to succeed, a cross-sectoral and cross-disciplinary approach will be needed. Provincial, national, and global experts, industry, volunteers, and government agencies, media outlets, global market research, and public opinion specialists are being called upon to join us on this initiative. The goal of CAA is to firmly establish Canada's role as a global leader in protecting and promoting human rights. Both current and future generations of people will benefit from it. In closing, ILC Canada and the IFA invites every Canadian, young and old, to join us as we embark on this multi-year campaign to combat ageism. Please feel free to contact either Margaret Gillis or myself. If you're interested to talk more about this, we welcome your input and your participation. Thank you very much for having me here. I pass it back to you. Thank you.
Thank you so much, Dr. Rabaharu. We really enjoyed your session. Is Margaret coming back on for Q&As or?
I'm here.
There she is. Always happy to, when everything works on Zoom for me, it makes me feel very happy. We actually didn't get any engagement in the Q&As.
One thing
I'm just double checking here.
As you do that, the one thing I was just thinking about is how, this new initiative around the Canadians Against Ageism is such a great timely project. I think in some of the initiatives that are already that are happening in terms of the work that's being done by the Canadian Network for the Prevention of Elder Abuse, which we're going to hear about in a minute, around the roadmap and the strategy and how these projects align. And I think you said it perfectly, both Kieran and Margaret, about how we need to work together across sectors. So there's many people online today that are from healthcare, which is your field of study, Dr. Kieran, and healthcare and community-based services and citizens and advocates. And I think I can't reinforce that enough, that we all can play into assisting in some of these projects and look deep within ourselves about what we can do and how we can contribute with any means. Now, I don't know if a website has been developed yet for that project. I know it may be living on ILC website or IFA, but once we get that information, we will be sharing that with our colleagues to give that information, and we will be sharing your contact information with individuals here if they are interested in joining that project and initiative for people. Now, I do see some questions popping up, so I'm going to turn it over to Laura here.
Absolutely. Thank you, Rayanne. So the first question is, what role does an employer have in support groups like the CAA?
Margit, shall I take that?
Yes, please.
Okay.
I'll let you take that.
So we're actually just in the planning stages of this whole initiative, and we have a dedicated section of the project towards institutions, and by institutions I mean any non-individuals that interact or faces older people on a day-to-day basis, whether it's health or employment or transportation, or whether it's communication, the lawyers, doctors, whatever. And we're going to be focusing on the whole organizational aspect, which is outward facing. Part of our strategy is to try and get baseline data to see how the institutions perceive ageism within their work, the work that they do with older people. And then at the same time, we're going to hopefully survey older people and get their view on how they perceive ageism when they interact with that sector of the institution. That'll give us at least some basic idea of what we're dealing with at a baseline. And then over the next few years, as we implement more interventions, and this is where we need your help. Everybody in Canada needs to be part of this. And hopefully we'll see the needle change in a more positive direction. I'm not sure if I answered your question or not, but that's what I have at this time.
No, that's wonderful. Next question is directly for you, Kieran, is how does ageism lead to the enormous $60 billion healthcare costs?
Well, I can honestly tell you, in the minute or so that we have to answer the question, I cannot do justice to it. It's a wonderful paper by Chang, and I can send that off to whoever wants to read it. And Becca Levy's paper is also, I think Ashton talked about it. Both of those are amazing studies that everyone should be aware of, the impact on health and the economic impact. And it was very well done. It was published in a very high impact journal just in the last couple of years. So
maybe send them to us, Kieran, and
yes.
When we post our webinar, we'll make those available for the attendees. And I think with the themes of questions that we're getting today, it just really highlights what an enormous issue this is. Every question we're getting are truly loaded and feel like another webinar in themselves. Next question, Margaret. How do we change things? A lot of organizations have started doing racism awareness training, culture awareness training. I've never seen ageism awareness training in the workplace. This would help people realize their biases and maybe help change things. How do you feel about that, Margaret?
I think that is a fabulous idea. And in fact, it's part of what Kieran and I discussed when we were thinking about some of the projects that we could do with under the Canadian Against Ageism project. It's interesting. Laura and I and Kieran have all had conversations about the movement to address ageism. And in a way, we like to say that it's kind of where feminism was in the 1960s, where really basic human rights violations aren't even recognized. And I think there's a real, we'll be successful when we start to get asked to do ageism courses all over the country. But I think that's a bit down the road. I think even getting people aware of ageism and recognizing the destruction that it does is our first goal. And also, as I said in the talk I gave, we need to see older people as rights holders. And I don't think we really do. And that's part of the beginning as well. So thanks for the question.
And we have one last question. I think it's a really nice way to close off your presentation is when we're looking about culture change, when we're talking about ageism, how do we move society from denial into actual action?
That's the work. You know?
I think I'll take a stab at this, and Margie, feel free to chime in. I think that the definition that WHO uses is perfect for ageism. It's really how our brain works, and every single day, all the time, we create new thoughts. Like we're all making new thoughts at this time, and then each thought is connected to a feeling, and that leads us to behave in a certain way. Right? That's how the brain works. And so when you have a positive thought, it makes us feel good, and then we smile or act positively. But if we have a negative thought, it leads us to have a negative emotion, and it leads to either frowning or crying or have a temper tantrum, what have you. That's what we need to change, is people's way of thinking, feeling, and behaving. Now, thinking and feeling is not easy to change, but behavior can be changed by shaping the behavior and by policy and laws. Like if you don't have proper policies and laws, then we'll have the same repeat that we did during the pandemic, where 80% of people who died because there was no laws governing long-term care in Canada, which is changing now, thankfully. So, I was going to put up a slide earlier, but I didn't. That aging is not in the top 10 issues in Canada. That's according to an Ipsos Reid survey done last year. It's way at the bottom. How do we bring that up from the 12th to 13th to up the first or second of 5 top things? And that's what we need to do, is to raise awareness that this is a big deal. We have data, but people don't know what the data is.
Well, once again, thank you so much. And I think this really highlights that this is truly just the beginning of the conversation. So thank you once again for your time this morning, and I'll pass it over to my colleague, Rayanne.
Thank you.
Thank you, Karen and Margaret, again, for sharing your knowledge on the issue around the Human Rights Convention. There's always new things happening, so we do appreciate you sharing that, and hopefully people will be able to attend your upcoming event on April 12th, which we've posted in the chat box. And for those who haven't been monitoring that, there's been a couple posts on the links, so people can register for that event as well. So we move to our last set of speakers for today to close the presentation for our conference. And I think it's very timely because we've talked about from a global perspective, we've talked it from a international, some of this work that's being done in the States around ageism, and now we're coming back to Canada about the work that we're doing to address the issue around ageism. And I'm so privileged to introduce my colleagues and friends, Margaret McPherson and Benedict Chaplin. So I would like to do our short introduction for each one of them. So Margaret is a research associate with the Center for Research and Education on Violence Against Women and Children from the University of, from Western University. I've worked with Margaret in the past with many projects around the It's Not Right campaign. Margaret designs and develops curriculum and related materials under a number of initiatives, including the It's Not Right initiative, as well as Make It Our Business workplace violence program. Margaret's passionate in her beliefs that everyone has an important contribution to make in creating safe and supportive environments at work and in our communities. So they welcome Margaret. And with her is Benedict. She is the executive director for the Canadian Network for the Prevention of Elder Abuse. There you are. So Benedict has been the ED since 2015 and became, or she's been involved with the network since 2015 and became the ED in 2018. Prior to her involvement at CNPA, she worked as a talent acquisition and nonprofit management in the arts and cultural sector. These are things that I'm learning about you. She's a board member at the National Initiative for the Care of the Elderly as well. And she was originally from France, and she now lives in British Columbia, in the unceded ancestral territory of the Coast Slavish people, including the territories of Musqueam, Squamish, and I'm going to get these wrong, Talysh Mattaway nations, known as Vancouver today. So thank you both. I am so pleased to have you present this national strategy on the roadmap on elder abuse prevention for Canada. So I will turn it over to, I believe, Benedict is going to start sharing her screen, followed by Margaret. So you're in for a great roadmap to learn about what you can do within Canada, within Ontario, depending on where you are. We've got many people from the different provinces and territories with us today. So you do fit into this roadmap, and I will let Benedict start the presentation. Thank you.
Thanks, Rayanne. Thanks, EAPO, for having us today. I must say it was very much worth getting up super early to be able to listen in to at least some of the presentations. And I'm delighted with what I heard, because it really does align with what we're going to talk about right now. So for those of you who might know already, last week, CNPA released Future Us, which is a roadmap to elder abuse prevention. And we like to say that it's an engagement strategy for anyone and everyone. You can access it actually starting now at futureus.cnpea.ca if you're curious. You can right now find it in English. The French version is going to be available a little bit later this week, so stay tuned for that. And we really hope that you're going to dig in, because I think from the questions that were asked in the chat box earlier, we are trying to provide some of these answers. You know, what can we do? What can you do at your own level as a citizen, as an employer? So I think you might find some relevant ideas in there. So the Future Us, it's a project that's been in the making for quite a while, but we've been working on it especially for the past year. And it's a project that we developed with a collaboration of like a whole team of partners, of advocates, professionals, researchers across Canada. And we're very grateful for the support that they provided to this idea and the ideas they brought to the table throughout the year. So you can see them on the screen right now. We have Western University, Crevac, Egal Canada, EAPO, of course, the International Longevity Center, so Margaret and Karen, CanAge, the National Initiative for the Care of the Elderly, the Canadian Centre for Elder Law, and also, of course, many thanks to our funder, Justice Canada, for actually seeing the value in this project. So we are extremely grateful to be able to talk about this directly today with you through this platform, and to talk about what we discussed over the year. The project was informed by consultations with leaders from elder abuse networks across the country where they exist. You can see them on the screen right now. We have the BC Association of Community Response Networks, PEAM, Prevent Elder Abuse Manitoba, Elder Abuse Prevention Ontario, the Alberta Elder Abuse Awareness Council, Seniors NL, and the Northwest Territories Senior Society. And where there are no current elder abuse prevention networks, we also connected with senior advocates and other professionals and government employees to hear what they had to say, and kind of take stock of where we are now and where we need to go. You know, what could elder prevention look like? What should it look like in the future? And what can we each and all do about it? So it was a fantastic opportunity for us to pool everyone at this in this conversation and get that bigger picture of what's happening, be able to provide an idea of where we're starting from. And we're not all starting from the same point, but there's enough of a base to kind of get us all going. So just to clarify, we're not saying that we're speaking for all the peoples and all the communities. It's really meant, Future Us is meant as a dynamic document. It's meant as a conversation starter that's going to ignite some ideas and some actions, hopefully across the country. It's meant to spark a dialogue and advance it when it comes to talking about elder abuse and ageism across Canada. So we hope that these conversations will include you. We hope that this will inspire you to take action. You will probably, if you go to the website that I mentioned earlier, futureus.cnpa.ca, you will find there's a toolkit tab with some additional tools and ideas and template letters to help you take action at your own level in your own corner of the country. And now I guess I will let Margaret take over and walk you through the key concepts and ideas behind Future Us. Go ahead, Margaret.
Thank you so much, Benedict. Hi, everyone. It's so nice to see you all on the call today. This is what I'm going to do is I'm just going to give you an overview of what's in the roadmap so that you have a sense about where we're starting from. It is designed as a pan-Canadian project because when we look across the country and we see the different jurisdictions, what we see is real unevenness in how we're approaching this. And I know I was listening to Karen and Margaret, speak about the importance of us working together and, creating this sense of change that is possible. So yes, it's true. Everyone has a role to play, but to be able to contribute, you have to know what you can do. And you have to also appreciate that there are different spheres of influence in which you can contribute. So get you thinking about those different places and to take seriously the little things we do in our day-to-day lives, really that add up to large-scale social change. That's what we're working toward. So I will speak about the goals a little more later on in the presentation, but just to start, there are 3 goals that we're using to guide the way. So these are kind of the compass points. So it is a roadmap with many avenues, sort of ways to work, starting from where you are across the country. But, we're aiming to achieve 3 common goals together. So prioritizing prevention, establishing a network of a Canadian network of elder abuse prevention networks at all levels, and then teaching everyone to be able to recognize signs of abuse and neglect so that, in our ordinary everyday lives, we have options every day. It's important to acknowledge that change is already happening. So we see the trailblazers and innovators across the country who are committed to doing this work around shifting social norms, so that we value older people, and as Kieran was saying, and ourselves, as we're aging, and the different experiences of aging. So governments have made investments. We're not at the beginning of anything, but it is uneven, as I say. So we want some kind of working together for consistent kinds of outcomes, but we're in motion. So what we want to do is suggest that if we consolidate and build on what is already working, we have to learn how to pool our actions to achieve collective goals. So we have to work collaboratively and systematically toward large-scale social change. And that means valuing every contribution, no matter how small or large. Everything adds up to, having collective impact. That's the road that we're walking. So the roadmap is set into 5 sections that, you can, in the online, sort of the PDF version of it, and on the website there are tabs that can take you right where you want to go. So if you just want to go to the part where you can contribute, then you're going to go to section 3. But if you're interested in sort of the introduction to the roadmap, you're in section 1, and section 2 talks about the goals with more detail. We want to see ourselves as part of a global picture, so other initiatives that are happening, and then of course the conclusion. So as we're starting the journey, there is the section about what do we know, and what do we know about ageism and the relationship with elder abuse, some of the definitions, what the research tells us. And so this is where are we starting from? I know that there's been a lot of talk already this morning about ageism, but really we have to understand that it is so deeply embedded in our systems and in our psyches, that we have to take time to reflect on the ways in which we've been recruited into a system that doesn't value people once they sort of are out of that working age life. So it's so common, and I do think it's powerful to recognize the moments when we're called to act in a different way. I live with my father, who's 90 years old, and every day I see how easy it is to be impatient or to push for something. And it asks for something from me to recognize, sort of the differences in who we are, and to respond in a way that actually communicates how much I love him and care about him and want him around for as long as possible. So it's deeply personal. And making this link between ageism, the way we think about getting older ourselves, the way we think about older people in general, and the sort of the slippery slope to abuse and neglect, is a lot of the connections that we need to be making. So that we know from the National Initiative Care for the Elderly, the NICE study that was done in 2015, that 7.5% of the surveyed population had experienced abuse in the year previous. We know that these are always conservative estimates, right? Because people don't talk about what's happening to them. People don't recognize what's happening to them as abuse and neglect, especially if it's normalized in the family or it's just been happening for a long time. Risk factors include depression, a history of abuse as a child, youth, or adult, right? So that life, we're not talking about isolated incidents. We're talking about, a lifetime. Over the course of the life, we have to be thinking about the way in which trauma and violence influence and inform us. Living with someone who is financially dependent and being female, there's a strong gender-based analysis that needs to be laid. That needs to be included in this, and an intersectional analysis to understand the ways in which people are, sort of additionally disadvantaged in society by their age, their race, their class, where they live geographically, their ability, all of these pieces, because we have to think more about the whole person and the way that in which that sort of structural violence, the social inequities are built into our society. Those are the things where, we have to work at. And in 81% of the reports, it's people right around the person, the older person, right, who are causing the harm. And I think that often, it doesn't start out as violence. It starts out subtly. And so learning to recognize those warning signs, being able to name abusive behavior when we see it, this is the work we all need to be doing. Of course, there are different forms of elder abuse, that we need to be recognizing. It's not just physical violence. And we also need to talk about domestic violence and how gender-based violence is also part of the continuum of violence that we talk about. Coercive, controlling behavior is a big part of that discussion. So in this area, we also want to talk about the current state of direct services and for older people who are experiencing abuse and neglect. And I have to say, it's a dire situation because there are few or no dedicated services that speak to what Kieran was saying, sort of the invisibility of aging sort of on the political landscape. And what we do have is a crisis-oriented response system. I think this is true across most of our complex social issues, which I would argue is the most expensive response possible. Elder abuse is often included under family violence, but it gets ignored, sort of subsumed under younger families' needs. That's what we hear from people who are working on the ground. There's little recognition of elder abuse in the community, and most seniors actually are living at home in private dwellings. And so what do we know about their experiences over the course of the pandemic? What do we know about their day-to-day lives? And there's little recognition of the need for specialization, training for professionals, so that if you're serving older adults, you have to be able to recognize the warning signs of abuse and neglect and indications of an escalating situation. We also know there's little or no risk management that's happening anywhere on the violence spectrum, which means working with the people who are causing the harm to change behavior, to help them make those changes that restore relationships. So really, this is about, we need to move upstream toward prevention. And this is something that we want people to be working into their conversations and their work on a day-to-day basis. Because elder abuse is a global issue. It's a whole society issue. It's not just about individuals. So we need a collective approach to make this kind of social change that we're talking about. This is the long game that we're playing. This is a long, term project over the course of our lives. And the World Health Organization and the ecological model can help us sort of better understand the relationship between things like policy directions and programs, and how those things sort of cascade down to the individual level. And so this is a diagram of the World Health Organization's ecological model. And if we're going to be strategic with our investments and our time and energy in terms of really going after the issue, then we have to think about all these levels and how we're going to align and integrate the work all the way up and down and across the system. So back to the goals. Prioritizing prevention in every community. This is, I know, it's a big deal that we're talking about. But if the work happens at the local level, it's the people on the ground who do the day-to-day work of prevention. How are we supporting them? And so one of the things that we need to do is prioritize prevention, get it onto the radar in every municipality in Canada, every community. And then the networks, we're going to talk more about that, and teaching everyone. This comes out of an evidence base on domestic homicide death reviews. It's always the people right around the family who know what's happening, but they don't know what to do. And so part of the work is about teaching them what they can do, small things, safely and effectively, that can absolutely make a difference. So in the second goal, the idea of building infrastructure, again, we already have lots of this in place. So especially in Ontario, we have local networks who do this really important work around public education and coordination of services in their communities. They lead on community coordination on this topic. We have Elder Abuse Prevention Ontario here. Not all the provinces and territories, though, have this level of network. And then, of course, we have the Canadian network that also doesn't receive, annualized funding. So a lot of the work is happening, off of project work, which is great, but it doesn't put the things in place that allow for sustainability over time and across election cycles, so that we can focus on really getting the best social return on the investments. And so in the roadmap, we also talk a little bit about what can networks do. I'm going to come back to that. We've done some estimates based on the existing networks. What would it actually cost to put this kind of pan-Canadian infrastructure into place, given that you can see examples of it everywhere except at the local level? There are really no local networks that are receiving any kind of annualized funding. And so that's part of the prevention thinking, right? If that's where the work is happening on the ground, then you really have to be investing at a local level. So our strategy is about engaging all levels of government in a conversation about cost sharing and aligning investments to achieve big collective goals around making sure that these conversations are happening in every community across the country. And we are already on our way. So this is just a little picture of, the number of provinces and territories that have an elder abuse strategy. Some of them are out of date. They need to be updated. The number of provinces and territories that have an elder abuse prevention network, and 4 of them have annualized funding. So we can look across the country. We have to think about ourselves as a whole sort of geographic area with lots of different and varied challenges, but working together on this kind of a big picture is what we want to do. So we do spend a little bit of time talking about the great value that these networks bring at the local, regional, and national levels. And, you know, the idea of being able to share information and ideas and strategies across the country is a powerful one. I see this happening. I talk to these dedicated people who give their time to it. You know, ageism happens by not funding things that are important, by expecting volunteers to do this kind of heavy lifting around social change. It is a way to think about how ageism infects sort of the whole system. And so we come to the third section around how can I contribute and where to start. You know, you're going to start from where you are. Start today. You don't have to wait for somebody else to make a decision. So everyone can learn to recognize the warning signs, to respond safely and supportively with a conversation, information, and then where to refer to find help in your community with services and supports. So I am pointing to the It's Not Right Neighbors, Friends, and Families for Older Adults campaign. It is a pan-Canadian project that was funded by the federal government. We've had a couple of projects to develop resources. And so you can participate in a workshop. In Ontario, you can contact, the Elder Abuse Prevention Ontario. They deliver this content. They work with the local networks to do it too. So support your local, provincial, territorial networks in learning yourself. And you can also just go to our website. So there's, information on the website, and we have seen that this investment, which has been piloted in every province and territory, makes a difference in people's lives. I can tell you so many stories about people say, I tried that conversation where I talked to somebody I was concerned about. I had a good response, or now I know what to do. Now I know what to watch for, what to be concerned about, and how to keep myself safe. These are the kinds of conversations we need to be having. And It's Not Right is already had investments made in it. Let's use it. One of the central ideas there, also echoed when I was listening to Kieran and Margaret talk, is that you are a powerful being in the world. Your every action has an impact. We have to rethink ourselves as not victims of circumstances so big beyond our control, but more about having an ability to make a difference every day. And then thinking about what kind of a difference you want to make in any given situation. Who do you want to be in this world that has so much trauma and violence going on in it right now? Who do you want to be in it? And let's join together for those of us who believe we can do better. Engagement is absolutely the key. So there are suggestions about things you can do. Join your local network, start a network, meet with your local elected officials in their home ridings. It's important for them to understand who the champions are, to become to ask them to be champions, with us in, talking to their parties and, engaging them in an informed way about what's happening in their communities. At an organizational level, leaders in all sectors can commit to also teaching their staff to recognize, respond, and refer, to learn about and address ageism in the workplace. So yes, the equity, the movement toward greater equity in our organizations is such an important one. Make sure that ageism is one of the inequities that are being addressed, both in the way that your organization functions, amongst your own workers, but also in working with the public. So we point to actions, such as organizing an It's Not Right workshop, but also professional development on recognizing warning signs and risk factors. We think this is a whole field of specialization that needs to be put into place with an expectation that professionals are aware of the ways in which ageism creeps into those relationships. One of the resources we point to is the Public Health Agency of Canada's work on investments on becoming trauma and violence informed as to advance equity issues in your organization. There's been a lot of investments made. Being trauma and violence informed is a Canadian innovation that builds on all that trauma informed work that was done, come out of the States quite a few years ago. Go to the Public Health Agency website, Google trauma and violence informed, and you'll find the information. Communities, here's where that first goal really is rooted in asking municipal governments, communities to identify elder abuse as a priority issue. And we have a map that we want to put yourselves on to show us how we're making progress over time. We point to the age-friendly movement as a way to, work that's already underway. Does it include elder abuse? And so again, you'll find actions there about things that you can do to engage your community. And we're defining community very broadly. Society. These are not competing issues like elder abuse, violence against women, child abuse across the lifespan. These issues shouldn't be competing with each other. They are signs of a failure in our social systems that doesn't acknowledge that people of all ages need a living income, they need housing they can afford, secure food, equity in healthcare. These are, human rights that we have to insist upon being observed and protected. So we always want to remember we're not just talking about individuals, we're talking about society as a whole. There's a section for researchers that includes ideas and principles and pathways about how to align elder abuse research in Canada, that recognizes different kinds of expertise, that pays attention to the systemic and structural issues caused by ageism and other kinds of inequities, engaging community and building capacity to work together so that the work is not so separate or siloed. And then, of course, appreciating distinct experience. And for government, we want to engage government as partners in this. So we are asking for an endorsement of the roadmap and the need for strategic investments in prevention, opening the conversations in places where it's not yet happening, thinking strategically together with funders about how to do more when there's already things happening, and thinking about it as a pan-Canadian project. So I come back to the picture about the role for governments in thinking about integrated and aligned infrastructure, cost sharing, so that we, provinces that are more able to pay for networks aren't the only ones who are doing it, that we are thinking about equity at all levels. And of course, the big picture aligning under global initiatives. I think that, a lot of the work around prevention has people feeling overwhelmed with the bigness of the issue and feeling alone in the work. And so I think that part of what we want to do with Future Us is to say, you are part of a very large movement of people who care about older people, ourselves as we're aging, and who are absolutely doing things that make a difference. These large global initiatives, only become realized when we make them our own. And so we know that there's lots of communities in Canada that are working on the age-friendly initiative, sustainable development goals, whatever you're working on, strengthening older people's rights, Margaret and Kieran were talking about. Let's, think about what has energy for you and do what you can to support them, and trust that you're not alone. There's lots of us working on this. We can share the responsibility for creating the future that we want. There's also Canadian initiatives that we want to be aligning with, right? So there's different bits of focus on particular issues, but they all, sort of align under, a better future. This is where we started when we were developing the project. We worked with partners to develop the strategy, and now we're at the point we've launched it, and we are working with the provincial and territorial networks, advocates across the country, to organize and mobilize people to say, what is it that we can do together to engage government partners, to engage our community people, to invite people to join us, because what we have to do is we have to learn how to push together toward a prevention agenda across the lifespan. So this is just a little summary. We have a little infographic that you'll be able to download from the website that just sort of maps out this idea about different ways to participate from wherever you are, starting with ourselves as citizens, and then, you know, depending on where you are and what else you do, other things that you can do as well. You have to ask yourself, what quality of life do you envision for yourself as you get older? And what do you hope for your children and your grandchildren? Please do join us, do what you can, and tell us what you're doing. The future of us is up to us, and so we do need you. Benedict noted that there's a toolkit that we'll be adding to this too. So the toolkit was designed for local networks and advocates. It has templates in it and ideas about how to engage your elected officials in your community, working with your community. And the website has a map on it. We want to be able to show progress over time. So this is just a launch, like we're just getting started. And we want to be able to report to you over time changes that we're making. And we want to achieve these 3 goals. So it would be great if you tell us about your activities, your ideas, and your updates, because it's really just the start of the conversation. And we will, you know, be in touch with you. So you have to stay in touch with us. What you do absolutely does make a difference. So I'm going to hand back to Benedict to wrap up for us. Yes, there's the little pin on the map.
Thank you so much, Margaret. I've listened to you talk about this so many times, and I still get completely caught up in it every time. So I hope that it had the same effect on all of you. I hope that this has inspired you to read the strategy and to start thinking about how you can participate and what you can do at your level. So as Margaret said, we've made the document available online, futureus.cnpa.ca. Have a look at the toolkit, put yourself on the map, and we hope that you will share Future Us widely with your networks, with your contact lists, talk about it in your communities, start thinking about what you can implement at your level. And of course, if you have any questions about any of this, you can find Margaret and I. We have put our contact information on the screen or had it, and you can always connect with us directly or through Rayanne. And also, we have a series of modules that is happening this week. So it starts today, actually, in about half an hour. And we're going to have 5 different modules that are going to address different aspects and different kind of lenses in relation to the roadmap. So the first one is an overview, very similar to what Margaret gave today. And the next ones are going to be looking at ideas and priorities for practice, research, policy, and the law. So those are all available through the NICE e-learning platform. The links have been shared on our screen, on our social media, on our website. I'm happy to add a link again in the chat box before we all part ways, and we invite you to sign up and listen to those. And if you can't this week, it's also available forever and ever on the NICE e-learning center, open and available to everyone. So thank you again, all of you, for attending, and I've seen a lot of messages in the chat box going through, so thanks for your engagement today, and thank you to EAPO and to all of our partners for the roadmap development for bringing us here today.
Thank you both for that great overview of the roadmap and the future us. And, you know, the title just aligns with everything that we've been talking about this morning about, you know, ageism. Kicked off our keynote presentation with Ashton this morning about, I think that's where she started with the future us. And so thank you. I hope everyone does go to the website. We put some links in there to check it out, download it, and look where you fit in. You know, that's kind of the common theme with this this event today is, where do you fit in on that roadmap? Where do you start? You know, at your intersection, not sure where to go. Like if you look there, there's a way, there's a role and an action that you can take to move along this shared journey with us as we move forward. And as Margaret and Benedict indicated, this is an ongoing journey that's going to evolve over time. And as we build it, within our provinces and across Canada together. We hope that in a year from now, we don't have to have these conversations. Wouldn't that be great? It would be awesome. Anyway, thank you so much again. And I look forward to continue working with you. And we've posted the information, and I'll put the link in for the Facebook live presentations as well. So I want to now turn it over to Marta to give our closing remarks for the conference today. I do, just before that, I do want to thank all of our speakers for their presentations today, and our board members who have joined us. Thank you.
Thank you, Rianne. And again, thank you to all our distinguished speakers. There was just so much expertise that you shared and demonstrated the tremendous commitment across the sector to what we're trying to achieve. It has been a very powerful and thought-provoking morning, and I would again like to thank you all for your time. I'm feeling very invigorated right now and ready to engage with not only the existing partners around this table, but also to bring into the fold some new partners, new community members that will help us advance this very critical call to action. Thank you to my staff for building this exceptional educational forum, Rianne for moderating, Laura for the question and answer period, and again, thank you all for your participation. A special call out to all our ASL interpreters for the amazing work that they continue to provide to our organization over the course of these provincial webinars. Tomorrow and Thursday, we're hosting a series of master classes that will continue to develop and explore these themes around elder abuse prevention. And while both dates are now sold out, I can promise you that we're already in the planning stages of the next educational offerings to our community to continue this very important conversation with everyone in the room. Thank you all for sharing your time with us, with your expertise, and we wish you a good day and be well.
I do want one last comment I did want to share with everyone is to continue on with this momentum of the conversation. June is coming up in terms of World Elder Abuse Awareness Day. And, you know, this is a great way to continue this engagement around the conversation around ageism and human rights. We are using the roadmap that's just been discussed in terms of putting some pledges out for people to engage on social media, engage in their communities. You'll see more of this. You can join up for onto the WEAD website. The website is www.wead.ca. It's a collaboration between Elder Abuse Prevention Ontario, CanAge, Laura Tamblin-Watt's organization, and the BCCRN, the British Columbia Community Response Network. We are building this. You can find information. You'll get updates on the newsletters that we send out to get up-to-date current information on WEAD. So a great way to keep involved in the work that we're doing as we lead up to the WEAD. We'll be hosting a virtual event again this year, again with some renowned speakers as we have last year for WEAD as well. The recording for this website or for this webinar will be at our website under the archived events. So you'll be able to find it on our website. We do have many resources and tools that you can find there as well. And these are just a sampling of some of the new collaterals that we've produced. And as Marta mentioned, our master classes are sold out for tomorrow. However, we will be doing more events in the future as well. Just as a final wrap up, you will get a pop-up message to do an evaluation at the end when we finish. We do encourage you just to take a couple minutes to give us your feedback. We do appreciate that and your ongoing contributions. And if you'd like to contact us, please feel free to reach out to us either by email or by phone to our head office. And we are on social media as well. So thank you all again. And thank you for everybody and have a great day.